So the first thing we have to acknowledge is that racism itself makes human beings sick. We're all subject to stress, and we're all the victims of the effects of chronic stress. But for minorities, and especially for people of color, that stress is added and unrelenting. Now, if you have that as a chronic stressor, that's going to lead to a variety of medical conditions. It's going to lead to hypertension, it's going to lead to cardiovascular disease, it's going to predispose you to stroke.
For every 100,000 African Americans, 208 die from heart disease. Whereas for every 100,000 white Americans, only 169 die. African Americans are 23% more likely to die from heart disease than a white person.
Allostatic load. That is the cumulative effect of stress on the body that leads to higher cardiovascular disease, diabetes, hypertension, cancer. All of these disease states are impacting this particular community, the Black community, disproportionately. And it's definitely related to ability to recognize the concerns that are being raised by these patients and having them taken as seriously as our white patients.
I had injured my knee, and I come into the exam room with the doctor, and he comes in and he never looks at me. He just looks at my knee and sort of has me stand up and down and then says, "You're okay," and kind of is going to shuttle me away. And so I mentioned to him that I'm a doctor, and then suddenly he looks at me and his eyes kind of light up, and he looks at my knee, he starts to talk to me, and so he really engages in this sort of doctor-patient exchange the way that it should have been from the beginning. And it was a really vivid illustration of how differently, I can perceive.
Given access to care, is there a difference in the quality of care received? And we found absolutely there was a striking difference. I truly think that most medical doctors go to work and other healthcare providers and try to do their best for their patients. If that's true, then there's a conundrum here. How is it possible with people with good intentions seeking to do their best can nonetheless, at the aggregate level, create a pattern of care that is so discriminatory? Our answer was implicit bias.
It is not acceptable that in disease after disease, whether it's cancer, heart disease, or any other, the African American community fares far worse than the white community.
We can save lives and stop racial injustice in healthcare by passing the Health Equity and Accountability Act, which takes concrete steps to make sure healthcare is culturally and linguistically appropriate, address diseases that have impacts on minorities, and improve health workforce diversity. And we should pass Medicare for all.
I believe strongly that from a policy position, Medicare for all is going to go a long way towards addressing these disparities, specifically because of reasons of economic differences being erased, but also because equity starts with patients all being considered of equal value.
If millions of people across this country stand up and involved in the political process and fight back, healthcare will be a right for all in the United States of America. Thank you all very much.